This is Andrea Kane, and I'm here with HIT 292 Healthcare Reimbursement. And this is the last part of Chapter 2, Part 2, and it is on coding compliance. And we are studying Principles of Healthcare Reimbursement, 6th edition by Ann Casto. So let's talk coding compliance. What is all involved? We're going to talk about compliance, fraud, and abuse. Very serious topics, although I will try and keep a positive note as we go through these. Compliance is performing one's job functions according to the laws, regulations, and guidelines set forth by Medicare and other third-party payers. We use AHIMA standards for ethical coding that are provided at the end of the chapter, and you can also go out to the AHIMA website and type in standards for ethical coding, and that will bring it up. It is very important that we do ethical coding. It is our professionalism, it is our reputation, it is our honesty and integrity on the line. Bottom line, we have to do the right thing every time, and the right thing is following the rules and the laws and the guidelines. Fraud. Fraud is intentionally misrepresenting something we know is false or that we don't believe is true, knowing that those misrepresentations could result in unauthorized benefit, i.e. reimbursement, to ourselves, our organizations, our providers, that sort of thing. It is also billing for a service that was not provided to the patient. And this is why we never, ever, ever code without documentation by the provider. If you don't have documentation by the provider, and I'm saying not on a Post-it note, you should not be coding. Without documentation, we have no proof that the service really was provided. If we know something to be false and we report it, we are committing fraud. If we don't believe something is true and we report it, it is fraud. And the benefit is sort of secondary. The whole thing comes back to, is it right? Is it true? Is it accurate? Is it complete? Is it timely? All those things. And if it's not, there's some question as to whether or not we should be doing that. Abuse. Abuse is unknowing or unintentional submission of an inaccurate claim for payment. There was something on there we didn't catch, or we didn't know, or maybe it's a computer glitch that we have no idea is happening. It is unknowing or unintentional, and it results in an inaccurate claim for payment. So let's say we missed whether the diagnosis was acute or chronic. We put down acute, but it turns out it was really chronic, something like that. That wasn't an intentional type situation. Or maybe someone, when they were mapping the charge master, they attached the wrong code, wrong CPT code to the charge master. And so when they added that procedure, it ended up on the claim, on the bill. None of us knew that that was being done. So abuse is unintentional, unknowing. Fraud is, you know it's wrong, or you have a gut feeling it's wrong, or you think it probably could be wrong, and you do it anyway. Abuse is, it was an accident, complete and utter accident. You may or may not have known about it, but it was an accident. It should never have happened, but it was an accident, and it ended up being something incorrect. So make sure you know the difference between fraud and abuse. Fraud is intentional. Abuse is accidental. But together they are both issues that compliance is supposed to prevent and deal with. Okay, False Claims Act. And all this is in your book, and I would encourage you to go there for the details. But it really goes back to the False Claim Act, which happened during the Civil War, where there were gun manufacturers who provided faulty weapons. They knew the weapons were faulty, but they provided them to the Union Army anyway, and it cost many soldiers their lives. And they got paid for those rifles only to find out only for the government to find out afterwards they were faulty. And that's where the Claims Act began. but it pretty much was put in mothballs, so to speak, for a number of years until we started talking about corporate compliance, and then it was brought back out and utilized with the corporate compliance programs that started rolling out. You have Operation Restore Trust from 1995. The Office of the Inspector General's Compliance Program Guidance came out in 1991 through 1998. Then you had Medicare integrity programs that started with a HIPAA legislation in 1996. You had a Balanced Budget Act of 1997 that built on that, and then you had improper payment legislation that came in a number of acts over the period of 2002 to 2013. All of these things play into compliance, fraud, and abuse as we know it today in 2020. Oversight of CMS claims payments. There are lots of people who have oversight of CMS claims payments, but there is the Medicare Review and Education Program. It allows CMS contractors to conduct improper payment reviews. Again, look at your textbook. Also look at prepayment and post-payment reviews. Again, those retrospective and prospective reviews, those occur. Provide education through medical reviews, provider outreach, and education. The goal is to reduce provider errors. A lot of this addresses the accidental part, the abuse, where something happens because someone didn't know any better, or they didn't have the details to make it clear to them, and they really truly just didn't know. But they also can identify from this people that are getting re-educated time and time again for the same problem or similar problems. Progressive corrective action is the next step. That is where you've gone beyond education, and so now there needs to be some correction here. They use data analysis, error detection, validation of errors, provider education, determination of review types, sampling of claims, and payment recovery. And they go through all these things. They have so many organizations and contractors that are out there that are looking for all these types of claims payment issues and identifying those, alerting organizations and payers and providers and of what's going on. And they do it with electronic computer algorithms. They can do it just by looking at codes and codes, how you submit your claim and what's on your claim. They have all sorts of edits that when the claim goes through, they have to pass all these edits in order for the bill to be processed by the MAC. So there's just so much to it. But let's talk about three to begin with here. The first one is CERT, C-E-R-T, Comprehensive Error Rate Testing. They measure your error rate. They look for when improper payments, they look at improper payments. What should not have been made? Was it for an ineligible recipient? Was it for an ineligible service? Is it a duplicate payment? Was the service not provided, or was the incorrect amount paid? That's what CERT is looking for, are those things. Then you have the OIG. And if you haven't already gone out to the OIG website and looked around, please do so. I'm sure you will do that at least once or twice or three times before you finish this program. But the OIG has a work plan that they publish every September, August usually, before their fiscal year starts September 1st. And they will go through and tell you what they are looking for and what they will be focusing on and what they intend to do. They will also periodically put out there what they have been doing and how many millions of dollars they have recouped from organizations and providers who have had issues and improper payments. They will also tell you who they have convicted and different stings that they have done in different states or places to identify fraud and abuse and rectify the issue, shall we say. They do provide education and develop policies and procedures. It's a great place to go look for information to educate yourself. They have published focus areas for the different departments of Office They have an Office of Audit Services, an Office of Evaluation and Inspections, an Office of Investigations, and Office of Counsel to the Inspector General. And I'd really recommend that you take an opportunity, go out, Google them, and click on those at the OIG website and just see what those departments do and what they're working on currently. Then you have the National Recovery Audit Program, also known by the infamous label of RAC, Recovery Audit Contractors. These are third-party companies that have been hired by the government, and they get a cut of what they find. So if they find and get money back from organizations, they get a cut of it. The government gets their piece, but these companies also do too. So it incentivizes them to find things, shall we say. And this is from personal experience. I have dealt with RACs myself. I have supervised people who were RAC coordinators and had to go through all the different levels of appeals processes all the way to the ALJ level. So I'm speaking from experience here. They prevent future improper payments, and they also go back and recover old ones. They do recover those improper payments. There are 5 components to RAC. They are looking to ensure accuracy, ensure efficiency and effectiveness, maximize transparency, minimize provider burden, and develop provider education. And don't get me wrong, I don't mean to be negative about RACs, because they honestly do find things, and it is good to know when you have made a mistake so that you can correct it, you can educate, and you can try and prevent it from ever happening again in the future. So in that sense, the RACs are very helpful, but they can also be very aggressive in trying to get their money back, and they can be downright frustrating to fight with them to help them understand where you're coming from, and to get them sometimes to accept your documentation. Coding compliance plans. You need to have a coding compliance plan. If you work for a provider or an organization, make sure you have a coding compliance plan. And in your coding compliance plan, you need to have policies and procedures about correct coding. Do you unbundle or upcode? The answer should be no, never. You do not unbundle, you do not upcode. And what is your definition of correct coding? How do you use your encoder software, and what is the correct use of that? How do you query physicians for clarification without leading them? You cannot lead a physician. You cannot give them a query that has a yes or no answer. You need to leave it open-ended. You need to give them the documentation that's already in the chart and ask them open-ended questions where they can clarify what's already been documented. Not add new information, not answer a yes or no question. Education and training. Your coding compliance plan should address payer guidelines, Medicare manuals, official coding guidelines. How do you make sure your coders are staying up on all of these? How do you make sure that you have current information available to everyone? How and when are you educating your providers? And what about others in your organization, like your CFO and the billing office? You also need to address internal benchmarking, external benchmarking, audit and monitor coding quality. How are you auditing and monitoring? How do you know your coders and coding are accurate? And are they, and how, and is it okay to have a 10% error rate versus a 2% error rate versus a 1% error rate? What's going on around you? What are other organizations doing? And how are they working? You want to use your Pepper reports, and we'll talk about those in either this class or other classes about Pepper reports and how they can be so useful for benchmarking. Again, this all needs to be laid out in your plan, and not just in your plan, but you actually need to live and work your plan. It's not enough to have it on paper or you have it electronically. That's great. Everybody needs it. But if you're not working it, if you're not keeping the information, you're not doing the audits on time, you're not reporting the results, you're not showing follow through on how you resolved and how you're preventing and how you're educating and all of that, the plan is worthless without follow through. So make sure if you're talking about plans, it's not just policies, procedures, education, training, auditing, and monitoring. It's then what do you do with that? How do you live it out? How can you demonstrate improvement over time? So that is that. That is the end of chapter 2 for where we are at. So I'm going to go ahead and let you go. I hope you're having a great day. Take care, and I'll be back to talk to you again soon. Bye.